Welcome to the deep dive. We've got a stack of sources here today, and we're going to unpack them. We want to understand something really vital for our pets' comfort, their well-being. The temporomandibular joint, the TMJ.
That's right. Yeah, we're diving deep into canine and feline TMJ disorders. And it's a surprisingly intricate bit of anatomy. And when things go wrong there, the impact can be pretty significant.
Right, so our mission today is, well, simple, really. We want to pull out the most important stuff from these sources about the joint itself, what can go wrong, basically giving you a shortcut to getting really well informed about this often overlooked area of pet health.
Absolutely. Because this joint, it does so much more than just chewing.
Totally. It
Uh,
affects their whole life if it's not working right.
exactly. I mean, think about it. Eating, drinking, grooming, even yawning, making sounds.
Mm.
It all depends on that jaw moving smoothly without pain.
Mm-mm.
So if the TMJ is compromised, well, all those basic things become really difficult, maybe even impossible.
Okay, so let's unpack that complexity, starting with the basics. What exactly is the temporomandibular joint?
Okay. So at its core, it's the connection point. It connects the lower jaw, the mandible, to the skull. It's actually a complex synovial joint.
Synovial, like our knee, sort of.
Similar type of joint, yeah, but obviously designed for very different, much more intricate movements, located just sort of in front of their ears.
Gotcha. And the parts.
Well, you've got the rounded end of the mandible that's called the condyle, and that fits into a little socket on the skull bone, the mandibular fossa.
Right. And isn't there like a cushion in there?
Yes, exactly. The articular disc, it's this small disc of cartilage, acts like a shock absorber, helps everything glide smoothly.
Okay.
Then supporting all that, you've got a strong joint capsule, ligaments. There's a lateral one in both dogs and cats. But interestingly, the sources mention a caudal ligament towards the back that's quite prominent in cats specifically.
Ah, cats again.
Yep. And then surrounding it all are those powerful chewing muscles, masticatory muscles, think temporalis, masseter, the main engines for chewing.
Okay, bones, disc, capsule, ligaments, muscles.
Mm.
Check. So what kind of movement are we talking about? Not just up and down.
Oh, no, it's way more than a simple hinge. I mean, yes, it opens and closes for, grabbing a toy or taking a bite,
Sure.
but it also allows for gliding and, really importantly, that side-to-side lateral motion that's absolutely crucial for grinding down food properly.
Especially for carnivores, I guess.
Right, and they use it constantly, grooming, yawning, any kind of barking or meowing.
Yeah.
It's always working.
Wow. It's actually amazing how much relies on this one tiny, busy joint.
It really is.
And I guess because it's so intricate and always moving, when something does go wrong, the consequences are pretty big.
They are, yeah. And the sources we looked at show a whole spectrum of possible problems.
So what are the main ways things can go wrong with the TMJ in dogs and cats based on this material? What categories are we looking at?
We can kind of group them by cause. So you've got traumatic injuries, sudden damage, then developmental issues, things they're born with or that show up early, and then inflammatory or degenerative conditions that, develop over time.
Okay, let's start with trauma. What kind of injuries happen to this joint?
Luxation or subluxation, that's basically dislocation.
Popping out of place.
Exactly. The mandibular condyle just pops out of that socket, the fossa. And the sources point out the most common way it goes is rostrodorsal,
Meaning?
forward and upward.
Ah, okay, so their jaw might look like it's stuck forward.
Precisely. And here's a little detail. Cats seem to be more prone to TMJ luxation than dogs,
Really? Why is that?
often from falls or fights. But get this, the sources even mention that something as simple as like excessive yawning can cause it in some cases.
No way. Just yawning too big.
Apparently so. It just shows the forces involved, I guess.
Wow. Okay, so dislocation. What else from trauma?
Fractures, of course. You can get fractures of the condyle itself or the fossa it sits in, or even the nearby zygomatic arch that's part of the cheekbone.
And how does that affect the jaw?
Well, a fractured zygomatic arch can actually trap a part of the mandible called the coronoid process and physically lock the jaw closed.
Ouch.
Yeah. And these kinds of traumatic injuries, they often happen along with other head trauma, as you might expect.
Makes sense. Okay, so that's sudden injuries. What about the problems that come from how the joint, developed in the first place?
Right, the developmental category. This includes things like dysplasia.
Abnormal development.
Exactly. The bones, the socket, they just didn't form quite right. This can lead to instability in the joint and problems like the jaw locking open sometimes,
Wow.
intermittently.
Are certain breeds more likely to have this?
Yes, the sources do list some specific breeds for TMJ dysplasia in dogs. Let's see. Basset hounds, Irish setters, Gordon setters, Cocker spaniels, and Cavalier King Charles spaniels. Though it's interesting, sometimes vets apparently find signs of dysplasia on x-rays just by chance, and the dog doesn't seem to have any actual problems from it.
An incidental finding.
Ah,
Huh. Okay, dysplasia. And then there's that other one, CMO, craniomandibular osteopathy. I know that affects some terriers.
that's the one. CMO is, it's a disease where there's this abnormal excessive bone growth. It affects the skull bones, including the TMJ area.
Nasty.
Yeah, it's mainly seen in young terriers, Westies, Scotties, Cairns are mentioned usually around 3 to 8 months old, and it causes significant pain, makes it really hard for them to open their mouths.
Okay, so injuries, developmental stuff. What's the third big group? Inflammatory or degenerative?
Yes, and this covers quite a few things, like arthritis or osteoarthritis, the kind of wear and tear joint disease we're all familiar with.
Right, same as in other joints.
Pretty much. It can be age-related, or it can happen after trauma, or because of underlying dysplasia, or even just chronic stress on the joint, like dogs that constantly carry heavy things in their mouth.
Ah, interesting. And arthritis leads to?
Pain, stiffness, sometimes that grinding sound or feeling called crepitus, and just generally reduced motion.
And ankylosis. That sounds serious, like permanent.
It is. Ankylosis means the joint has actually fused together, either with fibrous tissue or sometimes even solid bone.
Wow. They just can't open their mouth.
Severely limited opening, or sometimes completely unable to open it. The sources say the most common cause is really severe trauma, especially those condylar fractures in cats. The bone just heals wrong and fuses, or sometimes infection can cause it.
A totally locked jaw.
Yeah.
It's got to be awful.
Devastating for the animal. Now, here's a really key distinction the sources make. Masticatory muscle myositis, MN.
Ah, yes. The muscle issue, not the joint itself.
Exactly. It looks like a severe jaw problem because the animal often can't open its mouth, but the primary issue isn't the joint surfaces rubbing together.
So what is it then?
MMM is an immune system problem. The body's immune system mistakenly attacks the specific muscles used for chewing, the masticatory muscles.
Oh, wow. Autoimmune.
Right. In the acute phase, those muscles get swollen and really painful, which limits opening. But then in the chronic phase, the muscles actually waste away, they atrophy. And that leads to severe restriction, sometimes total inability to open the jaw because the muscles just can't function or stretch.
So the end result is a jaw function problem, but the root cause is the muscles being attacked.
Precisely. And that difference is critical for how you diagnose and treat it.
Makes sense. What else fits in this inflammatory degenerative bucket?
Well, you can also get straightforward infection, like osteomyelitis, a bone infection around the joint, and unfortunately, neoplasia tumors,
Cancer in the joint.
either starting right there in the joint tissues or invading from nearby structures.
Okay. So looking back across all those categories, it's everything from, simple dislocation to genetic issues, wear and tear, the immune system going haywire, infection, even cancer. That's a huge range for such a small area.
There really is. And the signs we actually see in pets can be just as varied.
Right. So what are the classic signs? What should someone be looking for if they suspect their pet might have a TMJ problem?
Well, the number one complaint, according to these sources, is difficulty opening or closing the mouth.
Either way.
Yes. And it can be subtle. Maybe they just don't yawn as wide as they used to, or it can be really obvious, like the jaw is clearly locked shut or hanging open.
Okay, limited motion. What about pain? How does that show up?
Pain is a big one. You might see them reluctant to eat, especially hard food. Maybe they suddenly prefer soft food, or they drop food while they're trying to chew. Sometimes they'll only chew on one side. They might cry out or yelp when eating, or even when yawning. Pawing at the face can be a sign. Or just tenderness if you gently touch the area near the jaw joint.
And are there specific weird movements you might see?
Yeah, definitely. Jaw locking is a major one. It could be intermittent comes and goes, which you might see with the dysplasia, or it could be persistent stuck, like with a bad luxation or ankylosis or chronic MM. Mandibular deviation is another. That's where the jaw shifts off to one side when they open or close. Usually points to a problem on just one side.
Makes sense.
You might actually hear clicking or popping sounds when the jaw moves. That often happens with luxations or arthritis. Or you might hear or feel crepitus, that gritty, grating sound, especially with arthritis or fractures.
Any other physical signs to watch for?
Yeah, you could see swelling or even a visible deformity around the jaw area that might suggest trauma or a tumor or that acute phase of MMM where the muscles are swollen.
Right.
And in chronic cases, especially that chronic MMM, you'll see really noticeable muscle atrophy.
Mm.
The muscles on top and sides of the head just look sunken in, wasted away.
Wow.
Drooling can also happen, maybe from pain, maybe because they literally can't close their mouth properly. And just generally, behavioral changes. An animal in chronic pain might become irritable or withdrawn, maybe less playful or active. It all stems from that discomfort.
Yeah, it's really clear these signs aren't trivial. They hit right at the core of their ability to eat, drink, just be comfortable.
Exactly, which is why figuring out precisely what's wrong is so important.
So how do vets go about diagnosing these specific TMJ problems? What's the process?
It always starts with a really thorough history from the owner, getting all the details about the signs, when they started, how they've changed, and then a very careful physical exam,
Trying to feel the joint.
palpating the jaw joints, the muscles, and carefully trying to assess the range of motion. How far can they open and close? Does it seem painful? Is there any clicking or deviation?
I bet getting a good feel for that can be tricky if the animal's in a lot of pain or stress.
Oh, absolutely. It can be really difficult. And the sources really stress this point. A proper full oral exam, which includes really assessing that jaw motion, often needs sedation or even general anesthesia.
To do it properly and without causing more pain.
Exactly. You just can't get the information you need otherwise sometimes.
Yeah, so history and exam, possibly under sedation. What about looking inside? Imaging. Do regular x-rays cut it?
Skull x-rays, radiographs are usually the first step, yeah. They can show big, obvious things, a clear dislocation, a major fracture, really advanced bony changes from arthritis or that CMO condition.
Right.
But the sources are clear about the limitations. There's just so much bony stuff overlapping in that part of the head.
Right, it's complex anatomy.
Very. So subtle problems, hairline fractures, early arthritic changes, they can easily be missed on plain x-rays. Positioning has to be absolutely perfect, but even then, it's often not detailed enough.
So x-rays are a starting point, but maybe not the whole picture. What's the next level up for imaging?
Okay, this is where it gets really interesting, and the sources talk about gold standards, but it's actually different depending on what you're looking for.
Okay, tell me more.
For bony problems, things affecting the bone itself, like fractures, erosion, fusion, tumors in the bone, the sources identify CT, computed tomography, as the gold standard.
Gold standard for bone.
Yeah.
And why CT? What makes it so good?
CT gives you these incredibly detailed cross-sectional images, and you can reconstruct them into 3D views. It's just vastly better than X-ray for finding those subtle fractures, for seeing exactly how much bone has been eroded by infection or arthritis, for mapping out bone fusion and ankylosis, or seeing the true extent of a bone tumor.
Crucial for planning surgery, too, I imagine.
Absolutely essential for planning surgery in that complex area.
Okay, so CT nails the hard stuff, the bone. What about all the soft bits we talked about earlier? The disc, the muscles, ligaments.
Right. And that's where the other gold standard comes in. According to the sources, MRI, magnetic resonance imaging, is the gold standard for looking at the soft tissues of the TMJ.
Okay, so it really depends on the tissue. CT for bone, MRI for soft tissue. That distinction feels like a really important takeaway.
It's a huge takeaway. MRI gives you much, much better pictures of that articular disc, so it's key if you suspect the disc has slipped out of place. It also shows the joint capsule, the ligaments, the chewing muscles.
Essential for diagnosing MMM, the muscle disease.
Exactly. And for seeing soft tissue tumors that might be invading the joint area.
Okay, imaging is key. CT for bone, MRI for soft tissue. Got it. Are there any lab tests that help pin things down?
Well, routine bloodwork CBC chemistry panel is usually done as part of a full health check. It's often normal in TMJ cases unless there's something else going on systemically, but it's good baseline info.
But are there any specific tests for these conditions?
Yes. There's one really important one mentioned for a specific condition.
Let me guess. For the masticatory muscle myositis. MM.
You got it. The sources specifically highlight the 2M antibody test. That's the key blood test for diagnosing MMM.
Good to know. Anything else?
Well, if there's a swelling or a mass, the vet might take a sample using a needle cytology or do a surgical biopsy to figure out if it's infection, inflammation, or a tumor. Analyzing the joint fluid itself can be done, but the sources suggest it's less common for the TMJ compared to, say, a knee or elbow joint.
Okay, so diagnosis really involves putting together the history, the exam findings, specialized imaging, knowing whether to reach for CT or MRI, and sometimes very specific lab tests, like that 2M antibody test.
That's the process.
So once you have that diagnosis, how do vets actually go about fixing the problem? What are the treatments?
Well, the treatment plan is definitely customized to the specific diagnosis, but across the board, two things are fundamental: managing pain effectively and making sure the animal can get enough nutrition.
Absolute critical first steps.
Totally. You have to address those regardless of what else you're doing.
Okay. So what are some of the specific treatments mentioned in the sources for the different conditions we talked about, like that acute luxation, the jaw popping out?
Right. If it's an acute dislocation caught early, the goal is usually close reduction.
Meaning putting it back without surgery.
Exactly. Done under general anesthesia, of course. The
Mhm.
technique described involves carefully manipulating the jaw and often using some kind of fulcrum. The sources actually mention using something like a pencil or a similar sized rod.
A pencil? Seriously?
Yeah. Placed between the molar teeth on that side. It acts as a pivot point to help lever the condyle back into the fossa.
Huh. That's a very practical, memorable detail.
It really illustrates the mechanics of it. After they pop it back in, getting follow-up imaging like X-rays or CT is crucial to make sure it's properly seated.
And does it stay in?
Sometimes it does, but if the joint feels unstable or if it keeps popping back out, they might need to provide some temporary support, like a soft muzzle worn for a few weeks or even temporary fixation to let the damaged joint capsule heal and tighten up.
And if closed reduction doesn't work, or it's an old injury?
Then it's open reduction surgery is needed. Same if there are fractures involved with the luxation.
Okay, what about treating the fractures themselves?
Fractures definitely need stabilization. Depending on where the fracture is and how bad it is, that might range from just using a muzzle for support to needing surgical wires, plates, or screws. These can be complex, and the sources suggest referral to a specialist is often a good idea.
Right, and ankylosis, the fused joint. What could be done there?
For ankylosis, the main option discussed is surgery specifically, and arthroplasty, often what's called a gap arthroplasty.
Meaning they create a gap?
Exactly. It's a pretty challenging surgery. It's considered a salvaged procedure where the surgeon basically removes the fused bone or tissue to create a space, a false joint, hoping to restore at least some ability to open the mouth.
Salvage procedure. Sounds like it's tough. Maybe not a guaranteed fix.
It is difficult surgery, yeah. There are potential complications, and the sources do mention there's a risk of the fusion happening again over time. While newer things like total joint replacement are being looked at in vet med, this gap arthroplasty is the more established approach described here.
Okay. How about just plain old arthritis?
Arthritis is typically managed conservatively, meaning without major surgery initially. The focus is on long-term comfort.
The pain meds.
Yes, things like NSAIDs, other pain relievers like gabapentin, maybe joint supplements, though the evidence varies. Definitely feeding a soft diet to reduce stress on the joint. Sometimes physical therapy can help.
And if that's not enough?
For really severe, painful arthritis that doesn't respond to conservative management, surgery is an option. A condylectomy is mentioned that's removing the mandibular condyle, the ball part of the joint. Again, it's considered a salvage procedure.
Okay. And what about the muscle condition, MMM? How is that treated?
Right. Masticatory muscle myositis. Since that's the immune system attacking the muscles, the treatment is aimed at suppressing the immune system.
Steroids.
Primarily, yes. High doses of corticosteroids, like prednisone, are the cornerstone. Then the dose is slowly tapered down over several months, carefully monitoring for relapse. Gentle physical therapy, like passive range of motion exercises for the jaw, can also be helpful during recovery to prevent excessive scar tissue formation.
Got it. And lastly, neoplasia tumors.
Tumor treatment really depends on the specific type of tumor and where exactly it is. Surgery to remove it is often the goal, but as we've said, surgery in this area is complex. Radiation therapy or chemotherapy might also be part of the plan, depending on the cancer's behavior. And I just want to circle back to that crucial support piece we mentioned earlier.
Nutritional support.
Yes. If the animal literally cannot eat because of pain or inability to open or close its mouth properly, maybe after surgery, the sources are very clear that feeding tubes are often necessary. Things like esophagostomy tubes or gastrostomy tubes might be needed to provide nutrition and hydration, sometimes short-term, sometimes even longer-term for chronic conditions.
It really sounds like managing these TMJ issues and the treatments can be quite intensive and require a lot of dedicated care from the owner.
They absolutely can. And that complexity, unfortunately, is often reflected in the prognosis, the likely outcome.
Right. So what is the typical outlook for these different TMJ disorders? Does it vary a lot?
It varies hugely. For something like a straightforward acute luxation that's put back in place successfully and stays put, the prognosis is often excellent. They can return to normal function.
That's good.
For CMO, that bone proliferation disease in terriers, the prognosis can actually be fair to good. The abnormal bone growth often stops once the dog finishes growing. The key is aggressive pain management during that active phase. Arthritis, well, it's usually manageable long-term with meds and diet changes, but it's unlikely to be cured. So the prognosis for, perfect pain-free function is more guarded.
And what about the really severe problems? Ankylosis, cancer?
Yeah, for ankylosis, even with that gap arthroplasty surgery, the prognosis is generally considered guarded because the surgery is difficult and there's that risk of it fusing up again. And for neoplasia, for tumors, it's highly variable depending on the cancer type, but often it's guarded to poor just because of the critical location and the aggressive nature of some cancers found there.
So close monitoring and ongoing care are absolutely essential after diagnosis and treatment.
Vital. Yeah, keeping a really close eye on their pain levels, assessing how well they can actually use their mouth range of motion, and making absolutely sure they're getting enough nutrition. That's crucial. Follow-up imaging might also be needed down the line to check progress.
And making sure owners are fully prepared for what's involved.
Client education is just paramount here. Owners need to understand the importance of consistent pain management, maybe permanent diet changes, sticking to medication schedules strictly, having realistic expectations about the prognosis for their pet's specific condition.
And the costs, the time commitment.
Exactly. The potential costs and the need for patience, especially during a long recovery, all of that is critical for a successful outcome. And the sources also strongly suggest that referral to a specialist, a veterinary dental specialist, or a surgeon with experience in this area is highly recommended for many of these complex TMJ cases.
That makes complete sense. It's definitely a specialized field requiring real expertise.
It really is.
Well, this has been fascinating. We've really gone from the delicate structure of this absolutely essential joint through the surprisingly wide range of things that can damage it, the clever ways vets use imaging like CT and MRI to pinpoint the problem.
Knowing which tool for which tissue.
Right. And then the diverse treatments from popping a joint back with a pencil to complex surgery, managing immune disease, and that vital supportive care like feeding tubes. We've definitely pulled some really valuable insights from these sources today.
We really have. It definitely highlights how much we rely on these seemingly simple mechanisms like chewing or yawning, and how profoundly disruptive it is for an animal when they fail.
Absolutely. And that brings us to a final thought, something for you, the listener, to mull over. Think about just how many times a day your own pet uses their jaw. Hundreds, thousands maybe. Not just for eating, but think about grooming, carrying their favorite toy, barking or meowing, just a simple yawn. How absolutely essential that small, intricate TMJ is for their basic, fundamental comfort and their very existence. So knowing all this now, how might your perspective shift the next time you notice something subtle? Maybe a slight hesitation before they eat hard kibble, or a yawn that doesn't seem quite as big as it used to, or even just a little change in their energy or mood. Could it possibly stem from some quiet discomfort in this vital, hardworking joint? Something to think about.